Hi, and welcome to the channel where we discuss medical topics and lifestyle. In today's video, we are talking about snoring and obstructive sleep apnea, otherwise known as OSA. It's a common and potentially serious sleep disorder that affects millions of people worldwide. I think in the UK, it's close to about 30 million people affected with snoring problems. And if left untreated, it can lead to a host of health problems, including high blood pressure, heart disease, stroke, depression. So in this video, we're going to talk about what snoring is and what OSA is. We're going to define it. We're going to go through causes. We're going to talk about signs and symptoms, treatment, and risk factors. So let's get into the video. And the main thing that we're going to distinguish is actually the difference between snoring and sleep apnea, because the term is thrown around quite often. So we're really going to nail into what each actually are and then build from there and go from there. All right, so let's define the two. What is snoring and what is OSA, obstructive sleep apnea? So, snoring, essentially, what happens there? So, during sleep, the pharyngeal airway, it narrows due to a decreased muscle tone. So, snoring essentially is a vibratory noise. It's a vibration generated from the pharynx and the soft palate as the air passes through this narrow space. So, you can see this in the diagram here in the first image. So, air is passing through this narrow space that's been a little bit narrowed. So, that's essentially what snoring is. And as the snoring gets worse, or as the airway narrows more, then that generally leads to social consequences. So, louder snoring, more trouble in bed. The partner can get upset. You can have a fear of traveling because you're snoring on the plane and things like that. So, those are the consequences of snoring. But then, if it gets even worse, then what can happen is you snore louder, you get labored inspiration, and you get apneic episodes. So those are episodes where you actually have a lack of oxygen, right? So it's an apneic episode where you can't breathe. And then that brings us to OSA. So that's a sleep disorder that's characterized by repeated episodes of breathing cessation during sleep. So it occurs when the pharyngeal airway completely closes during sleep, resulting in these apneic episodes. Now, that increased effort of inspiratory effort is sensed by the brain, and a transient arousal is then provoked. A few of these arousals don't matter, they can happen sometimes, but many of them per night, then that leads to the consequences of OSA, meaning fragmented sleep and then consequent daytime sleepiness. So, not tiredness, but sleepiness. And you can see that in the diagram where the airflow is completely cut off. So we've gone through some anatomy and definitions. Now let's get into the actual clinical features and potentially how to diagnose this kind of thing. So snoring is snoring, but how are we going to get into the territory of diagnosing OSA? So for obstructive sleep apnea, we have dominant features and we have other features as well. So the dominant features include excessive daytime sleepiness, like we mentioned. So it's not tiredness, but actual sleepiness, and impaired concentration and the things that come along with that, as well as snoring. And then for the other features, we have the typical kind of pictures of lack of sleep. So unrefreshing, restless sleep, you're irritable, you have low libido, you get those choking episodes in the middle of the night, and things just get progressively worse and worse. And so we move on to a way of actually categorizing this. So one thing that we use in clinical practice is the Epworth Sleepiness Scale. So basically, it describes a bunch of scenarios and the chances of dozing off in those scenarios. So when you're sitting and reading, when you're watching television, when you're sitting in a public place, when you're sitting in the passenger seat of a car, when you're driving the car and you're at a traffic light, when you're relaxing in the afternoon, after lunch, for example. So what are the chances of you dozing off? And then these paint a pretty clear picture if somebody actually has just simple snoring or actual sleep apnea going into that territory. And now we get into the causes of snoring and sleep apnea. So we described mechanisms a few minutes ago, but what are the actual causes? So that some are more clear cut than others. Others are more kind of risk factors or contributing factors, whereas others are specific causes. So the main one that I would say is overweight and smoking. So overweight, a neck circumference in particular of over 16 inches. So we described the mechanism of action earlier on. So it's that pressure that gets put into the pharynx, into the pharyngeal airway, that causes a narrowing. That's the trouble there. So we have age. It's more common in middle-aged men and older people. Family history is there. Habits and lifestyle. So evening, alcohol, and sedatives, that's a big one. Nasal congestion, hypothyroidism, receding lower jaw, large tonsils, and smoking. That's a big one. So the mechanism there is their inflammation and fluid retention in the upper airway. So these are all the causes of snoring and sleep apnea. And one very important one to mention here actually is sleep apnea in children. So it's common in children aged 2 to 7. When the tonsils are very, very large, then sleep disruption can happen. It can cause daytime sleepiness, hyperactivity, poor attention spans, and bad behavior. So if tonsils are big enough to produce sleep apnea, in the absence of getting constant tonsillitis and infections, then there may be something to do there, and we need to tackle that. In the next part of the video, we're going to talk about management, and I think it's the lifestyle factors are pretty evident here. So managing weight and some of these lifestyle habits are going to go a long way in preventing snoring and eventually apnea. So how are we managing this actually? So how are we managing snoring? So we have the initial approaches and then we have the clinically indicated approaches. So let's say you're having trouble with snoring and you go to see your GP. What's actually going to be happening there? So we're going to explore everything about what's going on in terms of taking a history. Then we're going to have some initial approaches. So changing sleeping positions, elevating the head a little bit, limiting the number of pillows, for example. So when it comes to the pillows, then one thick or two thin pillows is kind of the optimal size for maximizing the pharyngeal airway. Lifestyle habits, lifestyle interventions. So avoiding alcohol, losing weight, maybe even getting some earplugs for your wife or husband or whoever. So these are the lifestyle interventions. And then we have the clinically indicated things. So if we're going to be talking about that, that's where we're thinking about medication or medicating it. So if there's a lot of nasal congestion going on, we can start a steroid spray to help things out. If we're suspecting something systemic, we'll do a blood test. We'll check for your thyroid hormone, for example, right? Sometimes in menopausal women, this can happen. So we can consider the use of HRT. So there are things to discuss here. And if simple measures then fail, then we're going to be referring to a dentist, referring to an ENT, ears, nose, and throat specialist, considerations of surgery, of other kinds of management. So that's the management of snoring there. Now, adding on to that, the management of sleep apnea. So it's a lot of what we just mentioned, but with a few other things going on here. So with the help of our diagnostic tools like the Epworth Sleepiness Scale that we used earlier on, we're going to refer somebody with actual sleep apnea who we think it's sleep apnea to the sleep unit or somebody who specializes in sleep. There, we're going to do the proper diagnostic tests, we're going to confirm it, and then we're going to pop you on suitable therapy. A lot of the times that means CPAP therapy. So it's continuous positive airway pressure, which is a brilliant therapy that really helps with sleep apnea, but compliance becomes an issue because as you can see in the picture here, you have to attach the mask, you have to put it on every single night. Compliance. So whether somebody follows the rules and actually does it every night on a consistent basis, that's the question. But otherwise, it's a brilliant device and it really, really works in the management of sleep apnea. And there you have it. That's the story of snoring and sleep apnea. There's a lot to do there. There's a lot that you can do in terms of lifestyle interventions and things like that. And when it does happen, if it is confirmed, the management of sleep apnea is there as well. So these are all things to take into consideration. It's not a death sentence or anything like that. It's something that it's definitely manageable. Another caveat I would say is that if you have this, then please be careful when you're driving. Some countries they want you to inform the kind of the driving association, let's call it, or insurance companies if you're having sleep apnea. So these are things to keep in mind. But that's generally it. There's a lot to do there. We've gone through everything, and I hope you learned something. Like and subscribe for more. Leave a comment in the comments below, and we'll see you in the next one.